All right. Well, the number is still climbing, but I think in the interest of time, we will get started. And so I just want to wish everyone a very good morning, a good afternoon, a good evening from wherever you're joining us. We're very glad that you could be here for today's Path Live Forum, where we will be discussing making smarter malaria vector control a reality. And smarter vector control actually probably means different things to different people, but kind of what we're getting at today is we want to explore the best ways to operationalize innovation in vector control. We want to take a moment to reflect on some recent successes, some approaches that have been taken, and some lessons learned both from rolling out new versions of core vector control mainstays like long-lasting insecticided nets and IRS, so sort of like the next generation of those core tools, but also take a moment to reflect on the development of some novel approaches, some very innovative tools like spatial emanators and GM mosquitoes, and kind of tie everything into one discussion about how do we push these things out into the real world in the most efficient way. And so my name is Joe Wagman. Welcome everyone again. I'm the senior entomologist in the Malaria and Neglected Tropical Diseases program at PATH and a program advisor here to the malaria team. And I'm delighted to be moderating today's conversation. And I want to take a moment also to thank GlaxoSmithKline. Thank you, GSK, for supporting these sessions throughout the year, these Path Live forums. And I do think that the grant that they've given for this will continue into the next year. So please keep your eye out for other GSK-supported Path Live forums. I also kind of want to go over some logistics real quickly. We do offer today's seminar translated into French. So if you'd prefer to listen in French and follow along, you can go down to the translate button or interpret button, I think, on Zoom, and let us know if you have any trouble finding that, but that should be available to you. We want this to be as interactive as possible. So please share your questions in the comments. You can do that either directly in the chat box or in the dedicated Q&A box that should be available to you in Zoom as well. Do that anytime throughout the discussion, and we will be monitoring that. And we have saved some time at the end of the hour for an audience Q&A. And sometimes that's like the best part of these webinars too. So please don't be shy and go ahead and leave your comments and ask your questions by either method. Also should note that this call is being recorded and will be available after the fact if you missed something, or for those of our colleagues who are unable to attend. This is being recorded and will be distributed afterwards. And I can see, yeah, this is great. We do have participants joining from all over the world, and we have a reasonably diverse group. We have a lot of academia, some researchers. I see some government representative, and at least a handful of folks from national malaria control programs and some national level entomologists and some NGOs. This is great, and donors as well. So thanks everybody for joining us. So right now, I'll just go ahead and give a quick overview. I'll introduce our panelists, then I'll do my best to briefly frame this vector control discussion before we dive right into the facilitated question and answer and the discussions with the panelists. So we're honored to be joined today by a really crack group of public health leaders and researchers and really public health entomologists. So we're joined by Dr. Christen Fornadel from IVCC, which is the Innovative Vector Control Consortium, based in Liverpool, but Christen is joining today from her home in New Jersey. Hey, Christen. We've also got Dr. Alekos Simoni, another organization that's probably very familiar to us. He's from Target Malaria, where he's a technical support specialist. And I believe you're also based in the UK. So thank you for joining us, Dr. Simoni. And we also have Dr. Charles Wondji, who's the executive director at CRID, the Center for Research Infectious Diseases in Cameroon. And he has a deep level of expertise in basically all things vector control, insecticide resistance, and just, yeah, a wealth of knowledge, but hoping to pick his brain today on some of those novel vector control interventions that are brand new WHO pre-qualified product classes in some of the work that he's doing in that space. So thank you to all of you for being with us today. We do appreciate your time, and I think we have the stage set for a really rich discussion. So before we can really get started, we want to talk about making vector control smarter. And so why this is such an important conversation is because vector control is still very essential to the fight against malaria. And so vector control, again, just to be very broad, when we talk about this, we're talking about a wide variety of tools and interventions that are simply designed to interrupt and reduce human contact with the mosquitoes that transmit malaria. And it's a deceptively simple idea, a deceptively simple paradigm. Preventing mosquito bites prevents disease transmission. And so even though the paradigm is simple, the details in the actual execution of vector control can be really complex. The devil is in the details. But despite the challenges that we faced, for decades, the core malaria vector control interventions of ITNs, bed nets, and indoor residual spray, and to a lesser degree in some places, larval source management, they've been the backbone of national malaria control and elimination programs. And they've been the frontline defense against malaria transmission for millions of people. And to this day, they're still some of the most effective ways we have at actually reducing transmission. And just to take a moment to reflect on success, since 2000, during this kind of like latest iteration of a global malaria program, since that 2000 date, coordinated malaria vector control efforts have averted probably around 1.2 billion cases of malaria. And that is a quantification from the recent work from the Malaria Atlas Project. They have their preprint out, and there's a link to it here, and I encourage everyone to go check that out. But they describe the changing impact of malaria control in Africa. And even though we are facing some significant challenges, it's nice to say that we have been successful. But obviously, despite these successes and these impressive numbers, the job is not done. Malaria is still a problem. And even within this reasonably successful vector control world, we are every day facing new challenges that threaten the continued impact, the continued efficacy of these core interventions. We have to acknowledge that mosquitoes are becoming increasingly resistant to the insecticides that we rely on during BedNet and IRS campaigns. We have a limited roster of active ingredients available, and mosquitoes are really good at becoming resistant to those active ingredients. Apart from insecticide resistance, we should acknowledge that the massive success of the rollout, the large-scale deployment of IRS and ITNs means that we now have persistent and residual transmission that is often driven by mosquito behaviors that are not effectively targeted by IRS and ITNs. And I'm speaking specifically about outdoor and daytime biting behaviors. Add to that the reality that we're living in an era of climate change, not just climate change writ large, but also just changing local ecologies and changing land use patterns and invasive malaria vectors like Anopheles stevensii that are now present and dug in Africa. All of these changes mean that vector habitats are expanding and transmission dynamics are shifting, and this can make vector control decisions very complicated and very hard. And finally, let's also note that the shifting financial landscape is making it harder to achieve and sustain the high levels of coverage that are needed to maximize the impact of these tools that we have. So collectively, these challenges require us to adapt our approaches and also adopt innovation and really work hard to develop novel and new control tools. That kind of brings us to today's discussion, where countries have already started to roll out next generation ITNs and the latest generation of indoor residual spray products. And we want to learn some of the lessons about how to stratify and how to prioritize where to distribute which products into which communities. At the same time, experts are working in research and development and really field evaluations and piloting new tools, expanding the vector control toolbox with innovative approaches that have not yet been deployed at scale, and how these things could complement existing approaches. And today's conversation will hopefully take us through this very broad, very rich landscape, from the realities of deploying new tools to piloting brand new things and cutting edge research that may one day lead to game changers and step change interventions. So each of our speakers will offer different kind of insights and how we can develop and scale up these approaches. And this will be a facilitated discussion, but I hope that it feels a bit like a dialogue and a conversation. And again, encouraging everyone to post their questions as they think of them, and we will do our best to get to them. So anyway, that's just trying my best to set the stage. I probably took a little longer than I should have, but I'm going to throw it to you, Christen. And let's talk a little bit about those core interventions. And through your work at IVCC, I think you guys are really at the leading edge of scaling up access to new tools and new versions of mainstay vector control tools. So basically, a very broad question for you. What kind of insights have you gained when it comes to ensuring that these core interventions remain effective?
Thanks, Joe. Yeah, I think one of the biggest challenges that we face is insecticide resistance. So we worked through the New Nets project to scale up the first net that had not just a pyrethroid on it. So the chlorphenapyr pyrethroid nets, specifically at that time, it was the Interceptor G2 net. Other chlorphenapyr pyrethroid nets have now come on the market. But that started for us, the New Nets project started rolling those out in small scale pilots in 2019. And now those nets are basically making up the majority of nets that are being purchased by countries. However, we know that while happened with pyrethroid nets, when you blanket the continent with an intervention and an insecticide, that there's the risk that insecticide resistance is going to develop. So we can't just sort of sit on the fact that we developed these chlorphenapyr pyrethroid nets. They've overcome resistance to the extent where that map publication you referenced, you can
Mhm.
actually see there the impact that these next generation nets have had, and they have kept the malaria cases down to sort of that effectiveness level that we were getting from pyrethroid nets. So we were able to prevent the increase in cases due to resistance with the new nets. But we can't rest on those laurels. So here is just a slide from our IVCC portfolio and what we've got in the pipeline. We are continuing to screen for new novel active ingredients that are new to public health that are not used in agriculture. And that's sort of the first line here, that new active screening. We've got a couple compounds that are actually in the development stage now. And then moving forward, those compounds will be taken to net development. So in addition to, we've got the tenabenol, which is out already as an IRS that we're developing to put on a net, and another compound called flumetnicam that we're in development, pre-development stage on that to put on a net, as well as separately some repurposed agriculture chemistry. So we've got some brand new chemistry to public health that we're putting on nets, as well as a couple projects with manufacturers for repurposed agricultural chemistry, which might be able to get to market more quickly since they already have sort of the regulatory packages and there's a lot more known about them. So we've got all of that in the works for net. So hopefully within the next few years down the line, we'll be able to add in new products to rotate with the chlorphenapyr pyrethroid nets that are already on the market to try to prevent resistance to these new insecticide compounds and to maintain the effectiveness of nets for malaria prevention. As far as IRS goes, IVCC was instrumental in getting a number of products across. You can see in the sort of pink indoor residual spraying line here that we've now have Vectron product, which is a tenabenol IRS on the market that came out most recently. Of course, Atelic, which is still working really well. It's an organophosphate compound. It's still working really well in many areas. A number of neonicotinoid IRS products, and also very recently helped BASF get Solando, which is a chlorphenapyr IRS, over the finish line as well. So here we have a number of options. So if people are doing IRS, they have the ability to rotate between, hopefully at least 3 different insecticides, depending on what their current resistance profile is, to sort of maintain the effectiveness of those insecticides. I think I also just want to mention it's not really captured in this chart, but another piece of work we're following up on is we know there are concerns around the durability, both the physical and chemical durability of bed nets, that they're distributed in mass campaigns every 3 years, but it doesn't seem like they're either lasting physically or for some of the newer insecticides, chemically for that 3 year period. So that is something that we are now looking into as far as the durability, physical durability side. encouragingly, there was a WHO technical consultation this past August where we think we'll be able to move forward potentially with the adoption of something called a resistance to damage score that
Mm.
allows us to look at some physical characteristics of a net in terms of bursting strength, hole enlargement, snag strength. And if you can measure those physical properties of a net, you can actually predict how long those nets are going to last in the field. Um, every country obviously has a different environment, so that plays a big role. But the net itself also does play a factor. Some nets, those holes enlarge a lot more rapidly than others. And so hopefully this information now will be able to be available to your procurers like Global Fund or countries or the U.S. Malaria Program, and they'll be able to make more informed decisions about the products they purchase. And then going forward, um, uh, it's further behind, but something similar maybe one day we'll have on for the chemical and bioefficacy side of things. Yeah.
No, that's good. And I think it might be a little idealistic, but the hope would be with better indicators like the resistance to damage score, uh, elimination program could advocate not just for which products to buy, but maybe how often to buy them and maybe what cadence they should be distributing in mass campaigns and that sort of thing.
And in addition, I'd say that knowing that environmental piece that I was talking about earlier,
Mhm.
how what happens in a country also has a big impact on how long the net lasts.
Yep.
Separately, we're working on a publication on something called a risk index score that does help to sort of quantify how are people taking care of their net, what type of housing environment is it, and then if you could factor that into your procurement decisions as well, countries hopefully will be able to understand their environment a little better and be able to say, does it make sense to put a more expensive net here because it might help it last longer, or should we focus on more SBCC here because we know that there's a use issue and that's why the product's not lasting, or even, and I guess this ties into some of the some of the speakers later, should we be putting a novel intervention there? Should we do something else besides just nets to help us get further toward elimination?
Yep. No, those are great points. And I'm going to ask you one quick follow-up question, Kristen. It's kind of broad. You can be as specific as you want. You've already addressed it in part, but when it comes to actually rolling out these next generation products, whether or not it's a new net that's probably a little bit more expensive than the old net, or a new IRS active that's probably a little bit more expensive than the old one, what are some of the opportunities and challenges? What are some of the lessons learned from the new nets project and the engineers project about the challenges that countries face in actually introducing new tools at scale and how they can sort of justify that and work within those constraints?
Yeah, no, I mean, I think what's really important is generating that local data on resistance to make the case that these products
Mhm.
will potentially be more cost effective in the end, even if the cost up front is a little more because you are going to be able to kill more mosquitoes and avert more cases. So that local data is really important. It's also, understanding, as I said, the user environment. So does it really make sense in this area to do insecticide treated nets, or maybe IRS makes more sense because
Yeah.
people are just using the nets for fishing, or it's too hot and they're not using them in general. So does this area make more sense for IRS? Understanding the local mosquito behavior, if especially if even if mosquitoes are biting outside, if they're coming indoors to rest, maybe this is another reason why you might want to do IRS here, because you'll be able to kill those mosquitoes even if they're not biting inside. They might be biting outside, but if they're resting inside, IRS could still work as a great intervention. In terms of additionally, in terms of costs and trying to bring those down, as products are introduced, when they're first introduced, manufacturers are trying to recoup some of those R&D costs. But as we learned from the New Nets project, once you start to get the product to scale, you can get those volume costs to come down. For IRS, the manufacturers are really generally want to understand what the forecast will be. They want to know if they will be have a market to produce that product and what the size of that would be. And so part of what we learned under engineers was that consistency of that forecast to manufacturers was a way to help them keep those prices down. Because if they don't know that they're going to get more orders, the orders they do get that might have to charge a higher price because they don't know what's coming down the line. And so being able to sort of have that forecasting component and work with the manufacturers and help them understand volumes can help in the longer run bring prices down. But then I'd also say that for things like IRS, I know countries and through the VCWG Vector Control Working Group, Workstream 1 Task Team 3 is really looking at private sector and country funding to meet some of these gaps. And I think trying to understand the costs that it takes for countries to do an IRS program or for, a mission hospital or a mining company to do it can help us better maybe plan and help other countries take up some of those cost savings. So what does it actually take instead of looking at sort of just the global programs that have been implemented prior, like your PMI Evolve programs that are more gold-plated and run through the U.S. government. If you bring those costs down locally, can we save money? Can we get countries to implement IRS in a cheaper way? We've brought the insecticide costs down, but the big cost there is still implementation. So are there ways to save on those operational costs?
No, that's a good point. And I think it's a very broad answer, but it touches on just how complex these issues are. And we could probably have a whole other, webinar about the market forces and the economics of vector control and how hard it can be to make a case. But again, in the interest of time, let's shift gears. And I want to ask Dr. Wondji a question. And we're shifting gears in that we're all well aware that IRS and ITNs are very valuable tools. But I don't know, let's talk about something new and novel. You're working with a new WHO pre-qualified product class, spatial emanators, and they appear to be a very promising tool. And I just want to know from your perspective, Dr. Wondji, what appears to be promising about them, and what do you perceive their potential when it comes to real-world application?
Yes, Joe, and hi everyone. I think you are right. In August, we had the recommendation from WHO, a conditional recommendation that spatial emanators could be used in combination with bed nets, and this was a great news because the vector control toolbox was actually strengthened with that new paradigm tool. And we have to say that spatial emanators or spatial repellents, as we often also call it, are just small devices designed to be hung on walls indoors in households, and they are able to release active ingredient, and it's still at the moment pyrethroid, but this volatile can be released, and that could kill mosquitoes or can prevent mosquitoes to identify the host or to even to bite the humans. So because of that, it can be a good addition to the current insecticide-based intervention like bed net or even IRS. And there was particularly a trial done in Kenya funded by United that showed an added protection by up to 33% when spatial repellents were used on top of bed nets. And therefore, you can see that there is a tremendous potential with this tool. Although we have to say also there are still additional evidence that needs to be generated to strengthen how it could be deployed, how it could be used. And bearing this in mind, we can say that we now in a better position than just rely on, let's say, single tool. Vector control could be more efficient because we have a possibility to use a tool like spatial emanators. And one element also is that the compliance could be maybe better or a different nature than bed nets that you need to bring down every morning and every evening, and you may increase coverage, and it might even be suitable to areas where you are performing activities like seasonal malaria chemo prevention. On top of the intervention, you can add the special emanators. You can also use it if we can prove that it's a standalone tool. That's something important because we need to bear in mind the WHO recommendation is at the moment only to be used as a combined tool to bed nets. But if we were to evolve and demonstrate the ability of special emanators to be used as a standalone, it could even broaden the scope. It could allow NMCP to design subnational tailoring strategies where, depending of the burden of malaria, have areas of high transmission where you decide to combine both bed nets plus SR to bring the burden down. But there could be area where you could deploy one of the two tools alone. For example, in urban settings where you have moderate transmission, maybe you could deploy special emanators there because people could even be more likely to purchase the emanators as they are already doing with the coils. So I think the good news having special emanators now in the toolbox is that it can provide more flexibility. But the challenge is there because due to the additional costs, we need to make it more flexible. NMCP sometimes are struggling to have the full coverage with bednet. So we need to give them more evidence, more data to enable them to use this additional tool in a cost-effective manner. So that's something that we are working on to provide those evidence and accelerate adoption in a flexible manner for the NMCP.
No, that's great. And I think all of those questions that you kind of outlined are sometimes best addressed by these large scale pilot studies, which is something I'm a big advocate for. So I'm really happy to see that the Unitaid work is going forward. But I'm glad that you also mentioned that you always have to be cognizant, even though it bothers me, you've got to be cognizant about cost effectiveness. And so I just wondered can you speak to what it's like to try to collect cost effectiveness data during a piloted rollout of a brand new intervention? And yeah, I'll just leave it there and let you explore.
Yeah, as you are right. Thanks to Unitaid funding, we will be starting a large randomized controlled trials to generate evidence on how special emanators can provide added protection when used with bed nets. But also for the first time, we want in this trial to establish what is the level of protection when SR is used as a standalone, because we think it's very important. And also bear in mind, WHO recommendations are always taken using very robust data, and most of them comes from RCTs, and so to show the epidemiological impact of the tool. So that's why we are going to do the RCT, particularly in Cameroon, thanks to Unitaid funding. But although we'll be getting data on AP, the ENTO, one key aspect, as you highlighted, Joe, is the cost effectiveness, because this is a tremendous dimension with the reduced funding in the field. We need to ensure that any new intervention is cost effective in comparison to what is already there, like the bed net. So we'll be collecting data on the ground, but we'll also be doing some modeling to tell us whether the tool or how the tool could be combined, or what could be the cost if used as a standalone. So we will combine both the collecting empirical data on the ground, but also doing modeling. We have a colleague of us in Liverpool School, Elisha Smith. She'll be using a tool called MINT to actually predict model the cost effectiveness of special emanators in comparison to bed nets, or even when combined to bed nets. And that will allow NMCP to really understand what it could be done. But that will be the value of having such trials to be deployed at large scale. Data will be useful at different level, maybe not just cost effectiveness, even the comparison between bed nets versus special emanators, or when combined, and the ENTO data as well. What could be potentially the impact of existing pyrethroid resistance on the efficacy of these tools? Because we still need to bear in mind the emanators contains pyrethroids and is transfiltrate. So could there be potential resistance? Could it work against all major species of vectors? And thankfully, the site we are selecting, Cameroon, has all these elements, and we will be able to address these questions to catalyze adoption of special emanators.
No, that's great. And I'm really glad you mentioned the Mint tool as well, which is a web-based tool. I think our colleagues at the Imperial College have helped develop that. And it's really exciting and encouraging to know that some of the data that you generate will help the Mint tool in quantifying the
Absolutely.
effect of spatial emanators and how that plays into a cost-effective vector control strategy. So I didn't actually know that, but I'm really glad to know that the repellent data will then be entered into the Mint tool and will be available to
That's the goal, Joe, because we want to make it available to NMCP users
exactly.
such that they can make decision independently.
Yeah. Thank you, Dr. Wondji. That was great. And I think we're going to shift gears one last time. And it's funny to kind of frame this in cost effectiveness because, my goal one day is to still be, still have a career when we talk about trying to quantify the cost effectiveness of eliminating malaria because the math will change completely as you get, close to elimination. And so that brings me to the third speaker, Dr. Alekos Simoni, who is working on a potentially just enormously powerful tool. And we're talking about genetically modified mosquitoes, and I think specifically gene drive. So I know you have a couple of slides to go through. I'm just going to frame this as saying, like, with all of the challenges that we've already discussed today, like insecticide resistance and layering interventions on top of one another, my question to you, Dr. Simoni, is basically where are we at with gene drive, to put it bluntly? And then what are the next steps required to move this technology from the lab and from the semi-field out into, I'll say, the real world? And so I'll throw it over to you, Dr. Simoni, and I look forward to your presentation.
Thank you, Joe, and good morning, good afternoon to everybody. It's a pleasure to be here. Thank you for the introduction. I will start giving a brief introduction of what gene drive is for the people that are not familiar with, and then I will describe a bit more where we are in terms of development, and then what, as you asked, the next steps to move the technology from the lab to the field. Next slides, please. So as I don't know, I'm not controlling the slides. Okay, excellent, great. Yeah, as you know, all living organisms have DNA and genes, and the genes is what caused the traits that determines our differences, like mosquitoes and humans as well. We have two copies of each gene that are coming, one from the mother, one from the father. And we have the ability to alter or edit those genes in mosquitoes. And we can do that in a way that can help us to reduce malaria transmission. And there are several traits or genes that we can modify that could be useful for malaria control. For instance, you can change the mosquitoes to make it unable to transmit malaria, or you can make the mosquitoes unable to reproduce, to become sterile, or even changing the ratio between males and females in the mosquitoes. So those are some of the traits that we are able to edit and to alter in the laboratory to make somehow the mosquitoes to impact their ability for the mosquito to transmit malaria. But how can we then move this ability to alter genes in a way that is impactful in the real world? So can you go to the next slide? Every trait follows Mendelian inheritance rules. That means that they have a 50% chance of being inherited to the progeny. And that means in a population, if you introduce a modification or a new trait, let's say at 20% frequency, like indicated here with the blue mosquitoes, the frequency of this trait stays the same generation after generation because they follow Mendelian inheritance. A gene drive instead, if you go to the next slide, shows how this inheritance is modified to the previous one, sorry, yeah. And it shows here in green. So those are modified mosquitoes with a gene drive that instead of inheriting the modification to 50% of the progeny, they inherited to nearly all of the progeny. And generation after generation, the consequence is that the frequency of the gene drive can increase over time to the point that it can invade and transform an entire population. And this is very interesting and very important because a gene drive is this ability to spread a trait within a population. But how can we make a gene drive useful for malaria? If you go to the next slide, you can see two different approaches that both use gene drives in different ways. So the gene drive is the mechanism to spread a trait or a modification through a population. And you can use a gene drive to either what we call a population suppression approach, where you introduce a trait that makes mosquitoes sterile, for instance. And when you spread this modification, it also spread the sterility trait in a way that impacts the mosquito population size, that over time you can suppress the population to the point that there are not enough mosquitoes to transmit malaria. Or there is another approach, which is called population replacement, where you don't impact the size of the mosquito number, but you impact their ability to transmit malaria. And therefore, you replace a population with a new variant of mosquitoes that are unable to transmit. So both approaches use gene drives, but the aim and the goal is slightly different. If you go to the next, we at Target Malaria are focusing only on population suppression, while there are other projects that are working on developing gene drives for population replacement. To go to the next slide, you can see that our objectives at Target Malaria is to develop and share those genetic novel technologies for controlling Anopheles mosquitoes that are responsible for malaria in Africa. And those are very important in the context. What we heard also from the other speakers today is that gene drives are complementary to other existing methods. They are sustainable, long-term, and cost-effective. So they work together with the other methods. They are not impacting, and actually there are many theoretical and modeling evidence that they can improve and enhance even like vaccines or other interventions. So what we try to do is to develop those technology to reduce the population of mosquitoes that transmit malaria. If you go to the next slide, those are some of the key features of gene drives. As I said, they are long-term because they are self-sustaining. This mechanism of gene drives inheritance allow them to require a relatively number of released to sustain themselves. And they are compatible with other interventions. They are sustainable because they can applicable to many different ecological settings, and they are cost-effective in the long term. Next slide. We are specifically targeting at this stage 3 specific species which are part of the Anopheles gambia complex. And those are just a few of the many hundreds of species of mosquitoes that are present in the wild. If you go to the next slide, this is just a very technical slide. Apologies for this. This is just to show one type of gene that we develop in the lab. Those are some of the data that we are collecting. And this is a specific gene that target the fertility of mosquitoes. And it shows on the plot on the left, it's a bit complicated, a bit small, but what you see there, each dot is the number of larval progeny from a single mosquitoes. And the line where there is the arrow, it shows the modified mosquitoes with a gene drive. When it carries 2 copies of the gene drive, that specific mosquito becomes completely sterile and unable to produce any progeny. And this gene drive specifically also modifies somehow the morphology of the mosquito that makes it also unable to bite. On the right-hand side, you see what we call a population experiment that was done in lab, in cages, where we introduce some of those gene drive mosquito in a population. And you see that on the bottom right plot, that the frequency of those gene drives increases over time. This was an experiment that was lasting nearly a year. And the gene drive increased to 100% frequency. And this is reflected on the top panel when you see the number of eggs produced in those population, that when the gene drive increases, the number of eggs then decline to 0, showing that you can, in the lab, completely suppress mosquito population. So very, very powerful technology. Next slide shows instead not laboratory data, but more mathematical modeling simulation to predict what could happen in the field if you were to release those gene drives. This is a very interesting paper. I will not go into details, but this shows the predicted impact of gene drive on malaria transmission in many different countries in West Africa. And in all cases, you see that independently of the geographical location, you have a very strong suppression of mosquitoes that is sustained for many years, showing the actual potential for gene drives in controlling mosquitoes population and as a consequence also in reducing malaria. So if you go to the next slide, then now I want to talk a bit on how, where we are in taking the technology forward from the lab to the field. And of course, this is important because this is not just a theoretical idea, it's something that we really are striving to make it a reality and to see an impact in the real world. So there are it's difficult to deny that there is some uncertainty in terms of the regulatory landscape for regulating gene drives. This is a very powerful technology that has not been used ever in the world. But there are some precedents. There has been other GM mosquitoes released and used, not with the gene drive technologies, but this is also a very important precedent. There are other technologies that share some similarities, like Wolbachia or other type of biological control, where they can allow us to give us some precedent to work on and to reduce this uncertainty in the regulatory landscape. If you go to the next slide, one of the approach that we are using to move the technology forward is to apply a phased program of development and release of GM mosquitoes. And we started with sterile male mosquitoes that don't basically spread. The transgene does not persist in the environment. So they are very, let's say, easy to control. There is the second step, which is a fertile mosquitoes, but without a gene drive. And this also persist for a very limited period of time in the environment. And this allows us then to move to the third and final step of the technology pathway, where we actually have modified mosquitoes with a gene drive that will have a real impact on malaria. So we are following this pathway of development, and this allows us also to work with the regulators to implement and co-develop the technology in terms of regulatory framework. If you go to the next slide, we are also following extensive guidance, which is available for regulating genetically modified mosquitoes with gene drives from different organs and bodies. So there are the tools to regulate the technology. Next slide. We developed also internally together with other experts working on gene drive development considerations for how to design and perform a first field trial of low threshold gene drives. We are not there yet on releasing mosquitoes. They're still in the lab phase, but we are expecting to probably to release gene drive mosquitoes within the next 5 years. So we are working to design field trials, and we are following a recommendation from the WHO phases of field trials, where there is a causal pathway for efficacy, where there is the first step is to show a genetic efficacy, which is the ability of the mosquitoes to the gene drive mosquito to increase in frequency in the population, and that should lead to an entomological efficacy, where you actually see a reduction of mosquitoes number, and then this lead to an epidemiological efficacy. It's very likely that the very first field trials will focus only on some of those efficacy, probably just the genetic efficacy or the entomological, without being able to show the full epi impact, because that would require probably a very extremely large field trial, and as a first one probably is going to be much smaller. But this finished my slides. I just have a final one just to summarize some of the points that I made, that laboratory studies show very promising results for potential of having gene drives move to the field testing phase. And there are regulatory precedent to test gene drives in the field. And we, as I said, we are expecting the first field trial to occur in the next 5 years. And the primary objective initially will probably focus on genetic efficacy as the first step before moving to a full, potentially a cluster randomized field trial to show all epi impact for gene drives. That's it. The next slide is just the funding acknowledgements that are coming from the Gates Foundation Open Philanthropy Project. And yeah, I'm happy to take questions, and I really thank you the opportunity to be here to present what Target Malaria is doing.
Thank you so much, Alekos. That was a really fascinating presentation, and actually I learned quite a bit. It was really interesting to see the proposed sort of like WHO pathway, and it's encouraging to know. I mean, I know that you've been having these conversations for years, but that you've sat with WHO and mapped out sort of a path forward, even if it's kind of theoretical. But do you imagine at the end of this, there'll be like a pre-qualified product that is a genetically modified mosquito that a national malaria control program will purchase and deploy? Or like, how do you think that this technology will ultimately be available as a tool?
Yeah, it's a very interesting question. So first of all, something I didn't really mention, but there are many different types of gene drives. They
Yeah.
share some features, but they are very different in some others. So I think it will depend a lot on the different countries, ecological requirements, and endemic situations. But potentially, yes, I think if there is a gene drive that has been shown very promising result for field trials, that there could be the potential for having this product to be, let's say, acquired or used in other countries as well, following the same pathway. But I think more in the term there's going to be many different products, let's say, that could be more suitable in some areas than others. Also in terms of the ability of gene drive to spread, not all have the same um, spatial ability to spread. Some are more limited, some other are more faster or geographically more confined. So, there are different types of gene drives, but potentially, yes, I think the very first field trial will be very informative to see what is the real um, light potential for the technology. And that also will, you know, um, inform countries and government on how to the willingness to use this technology.
And then I've got one more question for you, Alekos, and I hope it's not too challenging, but I'm going to ask on behalf of a lot of colleagues and friends and loved ones I have in areas of Africa where Anopheles funestus is the dominant vector.
Yeah.
And so my question is, to get these genetic tools to work, how important is it to be able to colonize your primary vector and rear them at very large numbers? And what kind of challenges does that present?
Yeah, that's a great question. Yes, as I said, we are initially working on the Gambia complex species, but we are also starting to work on Funestus as well. We have a collaborator, Tony Nolan from the Liverpool School of Tropical Medicine, that is colonizing Funestus in the lab and is developing gene drive in Funestus as well. Is few years behind, but that is the next step, because in many countries, mathematical model predicts that without targeting Funestus as well, there's going to be a reduction in malaria, but not elimination. That's
Oh, yeah.
quite clear. So targeting Funestus is going to be important as well. But there is a huge variation between different countries and ecological settings, as you may know. But yes, Funestus is also another important vector. The beauty of gene drive is that it works within species that can mate to each other. So, for instance, targeting the Anopheles gambia complex, it's easy in the way because many species of the complex can interbreed, and therefore the gene drive technology can move within the species of the same complex. If you want to target species outside of the complex, you need to develop the gene drive directly in those species, and therefore needs the ability to colonize them in the lab, to be able to transform them. But for Funestus, it's possible.
Great. Thank you so much. So I think, yeah, we've reached that time in the presentation where we're going to actually go over some of the questions that have been put in the chat and in the Q&A, and I'll do my best to focus them. I have a question for you, Dr. Wondji, and it's really more of like a procedural question, but spatial emanators is one of these technologies that, yes, it has a pre-qualified product class. So when it comes to leveraging the data that you hope to generate in your pilot into new recommendations, what is the landscape now? Who do you anticipate working with, either at WHO or outside WHO, to help craft those recommendations that will follow how to deploy this now, established product class? Basically, who are you going to work with to help craft recommendations?
Yes, I think the first step is to ensure we generate robust evidence of a epidemiological protection from special emanators, either in combination with bednet that may allow us to get a full recommendation for the combined interventions,
Okay.
or we could establish that as a standalone and intervention. Once we have data, I think WHO has the guideline development group, and there is a entity of WHO in charge of assessing available data and they are able to look what is available, the robustness of the data, and then decide whether they can change the recommendation or not. So the key step is generating the evidence, and that's why through this United Funded project, we are in a good place to do so. But once the data is available, just like the case for Kenya, the data was reviewed and through a systematic review, and the evidence, the robustness was assessed and then put forward to WHO, and the committee, the guideline development group, was able to assess the available data and to decide whether to recommend or not. On this note, they decided to make a conditional recommendation because there were still some gaps that they wanted to be filled before providing the full recommendation.
No, thanks. That's really helpful. And I think a lot of us are familiar with sort of the older mechanisms with VCAG and whatnot, but it sounds like you're still very plugged in with the guideline development groups, and it's just comforting to know that those processes will continue. I've got a question for Christen. It's from Emo, and he just, you outlined the operational costs as a challenge for IRS, but we all know that IRS actually can be fabulously effective in a lot of scenarios. And so he's wondering if we should invest more into optimizing the operational aspects of IRS and bringing costs down from an operational and implementation perspective.
Yeah, definitely. And I think understanding, what it actually takes to implement the program is one way. But that question also reminded me that there's been work done on some partial spraying. So where you spray either the upper half of the room and the ceiling, or just for 80s they do it on the lower half of the wall, and just doing the lower half of the wall is effective. So if you know where your mosquitoes are resting, on the upper or lower half of the wall or the ceiling, if you target those areas specifically, you can reduce the time that sprayers are in a house, potentially reduce the amount of insecticide you're using, and that will reduce the costs of the overall campaign. So I don't know where it was left off. I know there were some HUT studies that PMI Evolve did on that showed promise. I think there were plans maybe to work on doing an RCT to look at it, but those had fallen through. So I'm not sure where sort of that stands in terms of generating that level of evidence, and if we do need to go to the RCT route, or there's other ways to generate that evidence for countries. But partial spraying does seem like it's potentially an option. As I said, for 80s, it's already being done. I know there's also some previous papers on band spraying. So you do these are from way back when, where you basically spray a swath, skip a section, spray another swath, skip a section. And so if we know that mosquitoes are moving around in the house, and they go up and down by temperature gradients, this is potentially a way to do it. Also, maybe there's other ways you can minimize sort of that target that you need for them to rest on, if you can more specifically figure out where they're resting. So I think there are some options there that are worth following up to help reduce those costs. And then especially if that reduction in costs means you can do more than one, you can put more than one tool in a location, right?
Yeah.
So instead of saying, IRS has to be done to the absolute best impact it can possibly be, and nets have to be done to the best impact. Well, if you have different tools and you can layer them, even if each tool has some holes, this is sort of going back to the COVID analogy. I think it was like, if you layer your slices of Swiss cheese, none of them are perfect. But if you can put multiple ones together, it's going to be really hard to get through, right? So if we can reduce the cost enough that you can use it with nets, or you can add a different prevention method, then I think we're really going to be making progress.
Yeah, and you sort of got to, I'm just going to have a personal reflection here, but you kind of had brought up a point, like with vector control, sometimes it's challenging to tease out what is a personal protective effect of, like, me sleeping under a physical net, and the community effect, and how do you balance those? And maybe you don't need to achieve really, really high IRS coverage if you have an insanely effective chemical. Like if you do every other house, you might, your indicator that shows, household coverage and personal protection might be a little lower, but maybe that's not the point. And I wonder sometimes how tools like genetically modified mosquitoes will navigate that. How do you actually measure the value of this to a community without really large, really expensive studies to show stepwise progress towards elimination? Another question for you, Dr. Simoni, and that is just describe the challenges that you guys face when trying to alleviate some fears about unintended ecological and human health side effects of releasing genetically modified organisms. I know that's a loaded question, but just
Yeah.
how do you guys try to address some of those concerns?
Yeah, that definitely. So safety for us is paramount importance, both in terms of ecosystem and human and animal health. We are following a recommendation how to perform environmental risk assessment to assess that very thoroughly. And it's also important to consider that the baseline for environmental risk assessment of GM mosquitoes is that GM mosquitoes should not pose more harms than wild mosquitoes and no more harm to the ecosystem than other vector control interventions. So that is the baseline to compare to what is already available. In terms of the ecosystem itself, we run a program in Ghana, for instance, that look at the role of Anopheles mosquitoes specifically as in the food web and as pollinators. The results are not out yet, but yeah, for preliminary analysis, we observe that they are not key. They don't have any key role in the ecosystem. They're not part of any major food web specifically, and they're part of the others. So mosquitoes does not seem to be key species in the ecosystem, but of course we are looking what is the role and what is the impact of reducing the number of mosquitoes. And as I said, there are many other mosquitoes, so we are targeting only the few Anopheles species transmitting malaria. So we are not really eliminating all mosquitoes. That's also something that probably is misunderstood.
Yeah. Thanks. So we have about 3 minutes left, so I'm going to ask each one of our panelists one question. Just try to be brief. And it ties into my closing remarks because I think we've done a good job of outlining the challenges and the complications, but it's also kind of an optimistic time, believe it or not. So just, I'll start with you, Christen, just going in chronological order. What's one thing that gives you optimism about the future of malaria vector control? Try to be brief because we're running out of time.
Oh, just that there are, new insecticides and new tools on the horizon. And I failed to mention, but, Charles was talking about with spatial emanators, there is that worry about the pyrethroid resistance, but we're already working on the next generation. So I think, we get them rolled out, and then there's going to be others down the line that are not pyrethroids. So they offer a real lot of promise, I think, as well coming up.
Charles, same question to you. What's one thing, broad level, that just gives you enthusiasm and optimism about malaria vector control in the near future?
The fact that we are in a position where the toolbox for vector control is being strengthened. For too long, we were relying on few traditional interventions. We are now in a position where we have new tools. Of course, we need to strengthen the evidence, but the NMCP may have more flexibility to choose from, and possibly we can implement subnational tailoring control to ensure that, wherever the need is, we can use the right tools to induce the impact we are looking for. So we can be optimistic that there are new tools. Mosquitoes is very dynamic, very flexible, but with the new tools, we can tackle it better.
Yeah, and Alekos, final question, same thing to you. What makes you excited about vector control?
Yeah, as Dr. Wondji just said, that the new tools that are coming along with new insecticides, new vaccine and gene drives and many others, they're really, I think we are in a turning point that in the next few years there's going to be a really impact on reducing malaria. So that's very exciting to see what comes next.
Excellent. So I just want to thank everyone again for joining this live forum. I want to thank GSK again for the financial support to do this. And just one last closing remark, we do have tools like drugs and vaccines, and we know how to prevent people from getting really sick, and we can prevent deaths with a variety of different tools. But when it comes to actually reducing transmission, and if you want to have an honest discussion about elimination or eradication, vector control still needs to be front and center, because for malaria and for a lot of other vector-borne disease as well, it's really the only tool we have at the moment to interrupt transmission. Now, hopefully that will change in the near future with some other transmission interrupting technologies. But for now, what we have is vector control. And if you have good vector control, it makes all of your other interventions work that much better, because they have to do less with your SMC and your vaccine campaigns and your diagnostics. And you're just asking them to do less. And so it makes the whole enterprise more cost effective whenever you have good vector control. So I'll leave it at that. Another huge thank you to our panelists and a big thank you to everyone who was able to join. And I guess keep an eye out for the recorded session, and you can catch up on things that you missed or distribute it to your colleagues who weren't able to join us today. So on behalf of Path and everyone else on the panel, thank you. Much appreciated.
Thank you. Bye-bye.
Thank you. Bye-bye.